Trump's onslaught of executive orders and actions are about paralyzing the population with shock and awe so we disengage. Shock and awe was originally a military strategy to literally shock the enemy with overwhelming sudden force, paralyzing them so much that they surrender. But it's also a political strategy to advance unpopular policies that usually enrich the few while the public is disoriented, as author Naomi Klein writes in her book, The Shock Doctrine. And Trump's team literally said,
"It's going to be shock and awe.
Shock and awe.
Shock and awe."
Studies show that when humans get overloaded with information, we become passive and disengaged. But here's how we can defend against it, as sociologist and mental health advocate Jennifer Walter laid out. She said to first set boundaries by picking just a few key issues that matter to you to focus on. Second, find trusted analysts who do the heavy lifting of synthesizing all the information. Third, remember that feeling overwhelmed is the point, so take breaks and process. Fourth, slow down. Walter says to wait 48 hours before reacting to new policies so that we can prioritize what's important instead of what feels urgent. And lastly, build community to share the load. She said it's a good idea to have different people track different issues so no individual gets too overloaded. She ends the thread by saying, "They want us scattered, our focus is our resistance."
I was tagged in this post, a warning from an OBGYN. This is in the child-free subreddit. It says, if you have the ability to become pregnant and want your tubes yeeted, get in ASAP with one of us on the Google Doc. The CDC has taken down STI treatment guidelines. PT education is still on the website, as well as MEC birth control guidance. My CDC STI app is not working. My OBGYN Facebook group is actively working on archiving these from people who have hard copies. I never plan to be subversive, yet this awful timeline leads us here. They are taking things offline for women's resources, not just in the child-free situation, but all over the place in the government. They are wiping web pages. The first comment has different resources with websites where women can find resources to help them with birth control and that kind of thing. She says, if more info needs to be added to the above URL, hit reply and the team will get to it shortly. Hit up the Wayback Machine if you need content from government sites that are now down. I own both domains and operate them for the public benefit. So it is childfreefriendlydoctors.com, the sterilization subreddit, and the reproductive rights.fyi. So these websites right here. It's crazy that people are having to go these lengths because of what Project 2025 is enforcing, because you know that they had this game plan already. We already knew that this was coming. Dr. Argavan on TikTok is also talking about how they wiped whole websites. If you're on TikTok, go over to her page. If you're on my YouTube page, I'm about to post this video right after. She is highly disturbed at what she is watching as far as them taking these resources offline. Even for researchers, they are taking away people's access to these systems. People should be highly disturbed about what is going on behind the scenes as they work to chip away at women's rights. They are working to chip away at women's rights on a national level. Folks did not believe that Project 2025 was here, but it is here. They made plans for this. They already knew what they were going to do once Trump got into office, and they are executing their plans without any pushback. Watch these videos. Sound alarms. Repost and share. If you're a content creator, please make your own content and make sure that they are being dispersed in multiple places on multiple platforms.
They are gutting the Office of Research for Women's Health. I'm going to say that again. They are gutting the Office for Research on Women's Health, which is the only office that exists for women's health research. Women, as you may know, make up half of the population, and they have scrubbed almost the entirety of that website. This is what the homepage used to look like. You see, we've got 6 different boxes, each of which goes to entire sections of the website. These include research programs and initiatives, the NIH's policy on sex as a biological variable, specifically in the context of research, the Office of Research on Women's Health e-learning courses, supporting women in biomedical careers, funding opportunities and notices, and then the Office of Autoimmune Disease Research. Out of all of these, the only page that still exists is the last one about autoimmune disease. If you're a researcher like me and you want to know what funding opportunities currently exist for women's health, page not found. You want to learn about women's health and how that relates to health equity? Page not found. You want to understand the importance of including women and minorities in clinical trials? Page not found. You want to know what the Office of Research for Women's Health has been doing for the last 25 years to advance women's health? Page not found. You want to understand how sex should be used as a biological variable in clinical research? Page not found. Just last month, December of 2024, the National Academies of Sciences, Engineering, and Medicine came out with a landmark report criticizing the National Institutes of Health, the NIH, for their lack of support for women's health research. In fact, they called for $16 billion in additional funding over the next 5 years for women's health research, and they asked for an institute, not just an office, of women's health research. Instead of doing that, the Trump administration is actually just wiping out the entire Office of Research on Women's Health. As you can tell, this has got me a little worked up, and for those of you who follow me, you know that you don't often see me this agitated. But when did the health of half of the country's population become DEI? Is that the guise under which they are removing all of this information? What is going to happen with this office? Nobody knows. There's no transparency. And I will tell you, as someone who is funded by the NIH, with my grant being co-sponsored by the Office of Research for Women's Health, this certainly does not give me any reassurance about the future of my grant. I know that there is a lot going on out there, and they want us all to feel overwhelmed. And if you do, we are in the same place. I know, for example, that the CDC has been scrubbed of quite a lot of information, including all of their guidelines and resources related to birth control. So I know this is not the only important thing happening, but I just am begging you to please consider taking action. Please consider contacting your members of Congress to let them know that this is not okay. We demand to have the Office of Research for Women's Health back online. We demand the office to be as resourced, if not better resourced than it was before. We cannot let them defund women's health, and I can't believe I have to say that.
People should be highly disturbed, highly like flaring up signals, warning signals about what Elon Musk is doing in this government. He is infiltrating the government. Yes, he did buy and pay for Trump, but the fact that he is doing this in our faces without any checks and balances is so disturbing and alarming to me. Raw Story says, great concern. And yeah, I would say I'm concerned. Musk aides reportedly lock civil servants out of computer systems. The aides Elon Musk brought to help purge the federal workforce have locked staffers of a U.S. government human resources agency out of computer systems with millions of employees' personal information. Reuters cited 2 agency officials revealing that Musk, who has not been hired, appointed, or confirmed to any government position, is at work trying to cut $2 trillion from the annual U.S. budget. Musk would still need to find over $1.3 trillion in additional cuts if every federal employee was cut. The cost of the entire federal workforce in 2022 was approximately $271 billion, the Bureau of Labor Statistics reported. The New York Times reported this week that billionaire Musk bought his computer engineers to handle his ongoing demands. Sound the alarm, people. As Musk brings his staff to the Office of Personnel Management, senior officials' access data to systems is being revoked. We have no visibility into what they are doing with the computer and data systems, one of the officials said. That is creating great concern. There is no oversight. It creates real cybersecurity and hacking implications. One key database, the official cited, is Enterprise Human Resources Integration, which has all of the birth dates, social security numbers, appraisals, home addresses, pay grades, and length of service of government workers. Reuters spoke with the University of Michigan professor Don Moynihan at the Ford School of Public Policy, who warned that there doesn't seem to be any congressional oversight over Trump and Musk. This makes it much harder for anyone outside of Musk in the inner circle at OPM to know what's going on, Moynihan said. The official said they still have the power to log on and access their emails, but there's no access to the massive data sets they managed. Musk demands that his team work overnight and 80-hour weeks to find all of the necessary cuts, violating federal labor laws unless a worker is paid overtime. However, it's unclear whether Musk or American taxpayers are paying those workers. Musk had sofa beds brought into the OPM office on January 20th, the day Trump took office, to ensure his personal team could work nonstop. The area can only be accessed with a special security badge or security expert, an OPM employee said. If you are not concerned, if you are not sounding alarm bells, you are not paying attention. There are so many things going on in the news right now, but Elon Musk subverting government should be like blasted several times. I talked about this story yesterday. I'm going to talk about it again because it is important. Trump and Elon Musk just pulled off another purge, and it's a scary one. If you are not political, knowing and understanding that Musk has so much power should scare the hell out of you. It should make you need to be political, because what they are about to do is touch your pocketbooks. If you don't care anything about anything else, you should care about your money. But too many people are not caring for for my taste. I just don't understand how people don't care what is going on right now. But you should care about your tax returns, about any kind of government payments you get. Do you get Medicare? Do you get Social Security? You need to care about what is going on if you don't care about anything else. Trump has granted Elon Musk unprecedented power to carry out his war on the deep state. The justification for this is supposed to be that the government is corrupted to its core precisely because it is stocked with unelected bureaucrats who are unaccountable to the people. And Elon Musk is unaccountable to the people because he has not been voted in by the people. Musk, goes this story, will employ his fearsome tech wizardry to root them out, restoring not just efficiency to government, but also the democratic accountability that deep state denizens have snuffed out, supposedly a major cause of many of our social ills. The startling news that a top Treasury Department official is departing after a dispute with Musk shows how deeply wrong that story truly is and why it's actively dangerous. The Washington Post reports that David Liebrick, who has carried out senior non-political roles at the department for decades, is leaving after officials on Musk's Department of Government Efficiency, or DOGE, sought to access Treasury payment system. Liebrick had a dispute with Musk surrogates over access to the payment system the U.S. government uses to disperse trillions of dollars every year, the people said. The exact nature of the disagreement was not immediately clear, they said. The news raises a complicated question. WTF? Precisely, WTF. Why is Musk DOGE trying to access payment systems inside the Treasury Department? It's not clear what relevance this would have on his ostensible role, which is to search for savings and inefficiency in government, not to directly influence whether previously authorized government obligations are honored. Another question, did Trump directly authorize Musk to do this, or did he not? Either answer is bad. If Trump did, he may be authorizing an unelected billionaire to exert unprecedented control over the internal workings of government payment systems. If he did not, then Musk may be going rogue to even a greater extent than we thought. I contacted a few former officials at the Treasury Department and the Office of Management and Budget, or OMB, to try to gauge what this means. What was striking is the level of alarm they evinced about it. Here's how the Post describes these systems. Typically, only a small number of career officials control Treasury's payment systems. Run by the Bureau of Fiscal Service, the sensitive systems control the flow of more than $6 trillion annually to households, businesses, and more nationwide. Tens, if not hundreds of millions of people across the country rely on the systems, which are responsible for distributing Social Security and Medicare benefits, salaries of federal personnel, payments to government contractors and grant recipients, and tax refunds, among tens of thousands of other functions. The officials I spoke with were at a loss to explain why Musk would want such access. They noted that while we don't know yet what Musk's motives, the move could potentially give DOGE the power to turn off all kinds of government payments in a targeted way. They said we now must establish if Musk is seeking to carry out what Trump tried via his federal funding freeze, turn off government payments previously authorized by Congress. The White House rescinded the freeze after a national outcry, but Trump's spokesperson vowed the hunt for spending to halt will continue. The former officials are asking, is this Treasury power grab a way to execute that? Anybody who would have access to these systems is in a position to turn off funding selectively, said Michael Linden, a former OMB official who is now director of Families Over Billionaires, a group fighting Trump's tax cuts for the rich. The only reason Musk wants to get himself in there is because he wants to turn some things off. These officials describe these systems as almost akin to a sense of faucets. A series of faucets. Congress, by authorizing payments, fills the tanks and decides where the water will ultimately flow. The team overseen by the now departing Liebrick, in effect, is in control of the spigots, these officials said. What also alarms these officials is that this is unfolding even as a debt ceiling crisis looms. When the government is on the verge of defaulting on its obligations, these officials tell me, it's Liebrick and his team who carefully monitor the situation to determine, to the greatest extent possible, on what date it will no longer be able to meet its obligations. This team monitors the water levels, these officials say, noting that this is how Treasury knows what to say in those letters that periodically warn Congress that a breach is approaching. As it happens, this is precisely why we want career, non-political civil servants to be in charge of the spigots. To put it delicately, this is some real complicated and we want the process to be administered in a totally non-politicized way. Letting someone like Musk anywhere near it risk corrupting it quite deeply. Okay, y'all. Please sound the alarm. If you're a content creator, please be creating content about this. If you're not a content creator, please share this, because this is highly disturbing. This is what did he say? Some really complicated and it's some disturbing Please, we have got to stop him. He is subverting everything. He is about to try to turn people's money off and take it for himself and the rest of the broligarchy. Like, comment, and share, please.
I'm going to tell you all right now, they do not give a damn about the cost of eggs. They do not give a damn about making your mortgage payment lower. They don't care about making your prescriptions more affordable. As a matter of fact, one of the first things that Donald Trump did was revoke the Biden executive order that lowered prescription drug prices. This is like the whole game right here. They are here for the fossil fuel CEOs. Los Angeles has been on fire. People have lost everything. And we haven't seen even a single shred of urgency from this Republican majority about even a disaster supplemental to help people get the FEMA assistance and everything that they need.
Anyone that's a union employee or an employee in general that voted for Trump was silly. He has been known to stiff employees. He's been known to stiff small business owners and contractors who's worked on his businesses. So why they would vote for this con artist is beyond me. But he's still trying to stiff union workers. He's still being anti-employee with this latest situation. Trump moves to cancel recent union agreements with federal workers. He's still trying to screw workers, but he is working for the broligarchs right now. Donald Trump said on Friday that any collective bargaining agreement reached with federal workers within 30 days of his inauguration will not be approved, the latest salvo in the U.S. president's bid to remake the federal workforce. In a memo addressed to the heads of all executive departments and agencies, Trump said former U.S. President Joe Biden's administration purposely finalized collective bargaining agreements with federal employees in its final days in an effort to harm my administration by extending its wasteful and failing policies beyond its time in office. It was not immediately clear how many agreements would be affected by the new policy, which refers to them as lame duck collective bargaining agreements. Collective bargaining agreements are deals between unions and their employees that outline working conditions, pay, and other policies. The move comes as President Donald Trump embarks on a massive makeover of the U.S. government, firing and sidelining hundreds of civil servants in his first steps towards downsizing the bureaucracy and installing more loyalists. The memo cites a U.S. Department of Education collective bargaining agreement reached 3 days before Trump took office that generally prohibits the agency from returning remote employees to their office. Trump has signed an executive order that would require federal employees to work in office 5 days a week, reversing a remote working trend that took off in the early stages of the COVID-19 pandemic. He's continuing to try to screw the American workers. Please explain to me how this will help people's bottom lines in their household budgets, how this will get grocery prices under control, how this will get housing prices under control. The people that voted for this, if you are a worker, if you're a part of a union, you are silly. And you did this to all of us. All right, y'all, join the conversation. Let me know what you think. Don't forget to like, comment, and share.
It is a sudden surge in flu cases, not just here in North Texas, but really nationwide. Just take a look at the latest cases that are being reported by the CDC. We want to show that to you. You can see that the majority of the country right now is red. They are reporting high, or in some cases very high, number of flu cases. Closer here to home, urgent care centers reporting that in North Texas they are slammed with patients, and schools are also reporting an uptick of absences. Our Caroline Vandergrift takes a look now at the numbers and what you can do to prevent the illness from hitting your household.
Just in the past 24 hours alone, the Cook Children's Emergency Department has seen nearly 700 patients. Doctors tell me that's an astronomical number, even for being in the middle of flu season. Children's Health reports a spike as well. The healthcare system primarily serves patients in Dallas and Collin counties. They saw 783 flu cases last week, which is an 83% increase from the week before. As for non-pediatric hospitals, the DFW Hospital Council says available bed space is okay for now, since most flu cases are treated in doctors' offices or at urgent cares. But cases are increasing at emergency rooms. Doctors say the flu has a wide range of symptoms, from coughing and congestion to nausea and vomiting. Usually the virus comes with body aches and a high fever. The flu normally lasts 5 to 7 days, and most people can treat it at home.
We try to get to every patient as quickly as we can, but there is an abundance of patients that are coming in through our doors. So really assess your child before you come into the emergency department for a few things: dehydration, prolonged fever for 5 days, or respiratory distress, breathing very fast, breathing very hard. Those are indications that you have to come to the emergency department. Other than that, try to utilize the other resources as far as your primary care physician and urgent cares.
Doctors stress the importance of all the typical prevention methods: frequent hand washing, cleaning shared surfaces, and staying home from school or work if you're sick. Parents across North Texas are telling me their children's schools are seeing a lot of absences because of the flu. We're waiting to hear exact numbers from the major school districts in the area. We're also asking if they're taking extra precautions to help stop the spread. In Fort Worth, I'm Caroline Vandergrift, CBS News, Texas.
Caroline, thank you very much. So let's talk about this just a little bit more here, because doctors say just because a child has a fever, it doesn't mean that they need to be rushed to the urgent care. In fact, what they're saying is if a baby is under 6 months, they say get seen as soon as possible. But most kids are fine to wait and to see their pediatrician the next morning if they are over 6 months, if they're drinking enough to urinate, and if they are not struggling to breathe. So keep that in mind.
You had a helicopter that had the ability to stop. I have helicopters. You can stop a helicopter very quickly. It had the ability to go up or down. It had the ability to turn. And the turn it made was not the correct turn, obviously. It did somewhat the opposite of what it was told. You could have slowed down the helicopter substantially. You could have stopped the helicopter. You could have gone up. You could have gone down. You could have gone straight up, straight down. You could have turned. You could have done a million different maneuvers. They shouldn't have been at the same height, because if it was at the same height, you could have gone under it or over it.